Okay, we're going now.
Yeah, still nobody there at the moment. Just let me know if you want me to start now, because I'm sure people will probably catch up on the recording. Perfect. Well, good afternoon or good morning. It depends when you are watching this recording back. I am Laura and I am from Oxford Medical Simulation. And today what I'm actually going to be taking you through is a virtual reality healthcare platform. So my background actually was originally teaching in a past life before moving over to the NHS. And so I worked within the simulation and the medical education team. And actually now I've kind of combined both of those roles, if you like, and here I am at OMS. I don't know if there'll be a bit of a mixture, but in terms of who would actually have access right now to OMS scenarios are going to be your foundation year ones. So if you're a foundation year one watching this, you are going to have access to 10 general medical emergencies. And if you're faculty that deal with undergraduates, or even if you're interested for postgraduate, get in touch and we can have a look into access. Let's tell you what it's all about. So in terms of the company itself, we have been around for about 3 or 4 years now, which doesn't seem all that long really, does it? But actually in terms of virtual reality, it hasn't been around that long at all. In the co-founder of the company is a doctor himself. So he was doing a lot of 360-degree videos. So if we've got anybody that's kind of into their simulation, it essentially takes a picture of your environment. So if you ever look at your house on Google and you're looking at your street, that is 360-degree video. You see your environment, but you can't really interact. And in terms of when we use that in the medical field, that can be quite linear. And so he started there and was coming up against a lot of the issues we all come up against in simulation. People want more of it. They want more. We can be limited by space, by faculty time. And so that brought him down the virtual reality route. So it was at that time that they became cost effective. So he thought, let me see if this is going to work. And it turned out it did. So here we are. So ultimately, we are here to transform simulation and to improve patient care is the bottom line. Now, I like to point out that this is not to replace physical sim. What you do already is incredibly effective, but I think in the last 12 months, there's been a massive impact. And for me, where I see this fitting for you is having that tool belt of different resources. And as you go into teaching, you think, these are my learning objectives. This is what I'm trying to achieve. And then you think about what's the best tool for the job. So where we tend to fit is general medical emergencies. And I will show you the different libraries in just a second. In terms of what it's really designed to focus in on, it's that clinical reasoning, critical thinking, and decision making. So why do we do it? To help make things more scalable, more accessible, cheaper, more interactive. And in terms of who we are, most of the company, actually, we are from the NHS ourselves. So from the NHS for the NHS. And a lot of our clinical writers still work actively now. And the other small portion of the company is actually things like game designers, animators. We say, you know, this is what would actually work and would happen on a ward. And they take all of our ideas and they put it all into action, if you like. So they make everything look incredibly realistic. Now, I will take you into the libraries, but just before we do, it's really to focus on what do I mean? So when I mean virtual reality or how you're going to deliver it, essentially you can deliver this in two ways. In a virtual reality headset, now we use the Oculus. So if you've got an Oculus Rift, Rift S, Quest 2, this will work. We get asked quite a lot, will this work on things like your PlayStation VR headset? So if anybody's got kids out there, or they might have one themselves, PlayStation have a VR headset, for example, it doesn't have 6 degrees of freedom. So what do I mean when I say that? With the high-end headsets, what they have is the ability to make things look and feel incredibly realistic. So as you move, there's no lag time. With lower-end headsets, there can be a slight lag time, and that it just almost can give you motion sickness. Whereas with these, you won't get that. You can get right down on the floor. You can have a look at how much is in that catheter bag, for instance, and you can move around as you naturally would in real life. So that is one option. The other option, which is much more accessible if you're thinking in terms of scaling this out to trainees or clinicians, on-screen simulation. So you can flex between both. To suit your needs on that particular day at that particular time. So it might be that you've got a group of trainees, great, pop somebody in VR, link it up to a big TV screen, and actually have a whole lecture theatre of trainees watching as they go through, and you debrief off the back. Versus, you know, it might be winter pressures, people can't get in because it's snowing, or, you know, teaching's got cancelled for whatever reason. Lean on your on-screen learning. Okay, guys, today, Tuesday, we're going to meet up at this time and I'm going to take you through a scenario, and you just jump onto Teams or Zoom and you go through that scenario. I will take you into all of the scenarios and how that works practically in just a second. Now, you can use this for teaching and learning. That's one part of it. And I think more and more what we're seeing is people are now starting to go down the route of recruitment, for example. So we have institutions, or an institution that puts people in an interview and then follows it on with one of our scenarios. Also, you've got things like overseas, doctors and nurses, if they're coming over, making sure that they can meet your specifications, or, you know, the last 12 years, a lot of people have just seen a lot of COVID. So do they need, you know, have you got low confidence that you need something to support those learners? So there's lots of different areas that this could sit within, and this blends perfectly well alongside what you already do in physical sim as well. I'm going to skip through these. I think we can all appreciate all of these things. But essentially, let's think about the platform and how it's been designed. So the first part of the platform itself is that clinical experience on demand. So whether that is an anaphylaxis scenario, a seizure, a DKA, when you're taken into a scenario, you are presented with a patient on a bed and you have a nurse who assists you. Once you've done everything you think you can do, you then click to leave via the door as if you're walking out of the ward, and it transitions you through to this middle section, which is your self-guided reflection and feedback. This supports things like e-portfolios, revalidation, simulated hours. So they can reflect, they can go back to any of their reflections and their feedback. They can export them from the web app, and I'll show you how to do that today. So it can support all of those things as well. So if you are maybe an educational supervisor watching this, you might not want to play the scenarios, but what you might want to be looking at is all their feedback and, you know, who's jumping in, who's engaging, what kind of feedback are they getting, and use it for your discussions. And then that final part is the data analytics and reporting. So one of the things that's quite hard to do in physical sim was to kind of work out, you know, how are they engaging, where are our gaps in learning, etc. So actually this is all inbuilt in the background. So if you're thinking return on investment or anything to do with that, you've got all of that feeding through in the background. And actually, if you did scale this out to trainees at a distance and they're jumping in 10 o'clock at night whenever they want on their own without faculty, you can still see exactly what they're getting up to. So you can do this with faculty, and one of the great things, you can do this completely faculty free. Before I jump into the platform, I am going to skip ahead and actually show you the scenarios that we offer. So different libraries catering to different specialties. Now you've got your medical emergencies library there, for example. Now that's brilliant for advanced nurse practitioners as well. I'd definitely put in my advanced nurses in that one. In terms of the medical library, the nursing library, you've got the same 20 scenarios, but actually, have I got them on here? No. So we have got a nursing library as well, perfect for medical students, same 20 scenarios, but you approach them completely differently. Within the nursing scenarios, different amount of time is allotted. You've got things like an SBAR handover, a news chart, so much more documentation. They have to get their prescriptions prescribed, whereas in the medical one, it's completely open. You just go in and you make all the decisions. Also got a paediatrics library there, mental health, obstetrics, interprofessional. So today I'm going to show you the single player scenarios, but there are interprofessional scenarios in the background. Let's jump into the platform itself and show you what it's all about. Hopefully you can see my screen and it's changed and you've got a log on page. Different packages that we offer, but essentially what typically happens is you get an individual sign on. So you would sign on to the platform as a trainee or a clinician. And at that point, you will see all the scenarios that have been made available to you. As I scroll down, you will notice different tiles. These are all different scenarios, different experiences. You will notice it doesn't tell you what these experiences are because we want that person to walk in to these scenarios as if they were walking onto a ward. They don't know what they're going to be met with. This is a tutorial. I'm not going to jump into that today, but for those that have never been in the platform before, that's a perfect place to start, and the nurse actually guides you around the room. I'm going to jump into George today. So this is actually, I'm going to tell you, but it's a sepsis scenario. At this point, if we were going in a virtual reality headset, we would pop that on. But I'm just going to do this solely on screen today, just like you could do with your trainees. So this will hopefully load. I'm hoping everybody can hear and see the nurse. Do shout out if you can't hear this. But hopefully we'll get a handover from our nurse and then I will guide us round the room.
Hello, doctor. I'm really worried about this new patient, George. He's just come into the department and looks really unwell. I've not got any background information yet, but I'm really worried about him. Can you come and see him now?
Hello, George. What can I do for you today?
Hi, Doctor. Thanks for coming. I feel terrible. I hope you can find out what's going on.
So this is, I can move around this room, by the way, just using my arrow keys. I can rotate using my mouse. In terms of VR, you just walk around as you normally would, so that would be nice and easy. First thing you'll notice along the back wall, 14 minutes or 15 minutes on the clock, and it counts back. So there is that added time pressure as well. In the nursing scenarios, you have 20 minutes. Mental health a bit more, I think it's 25, just because you would dig in a lot more to talking to that patient. In terms of George, we can get up quite creepily close to George. This looks even more realistic and scary in real life, but hopefully you can see he's quite sweaty and it's realistic. In terms of the scenario, certain things glow blue. Anything that glows blue, you can interact with. So I can look at that monitor, I can click, the nurse jumps into action, pops on that SATS Pro.
That's the monitoring in place.
And all your observations come up. So as I said, these are dynamic. So if I went ahead, popped on a non-rebreathe mask to pick up his oxygen levels, she'll pop that on, and in just a second, that will react accordingly to my decision making. So you don't need to sit there in the background anymore and tinker with anything. It will just do it for you. You'll see fluids, you'll see bloods. Nothing running through right now, but when you're ready, they are there and you can select exactly what you would want to give. You've got your nurse, so you can ask her to do things for you. So for example, I'll ask her to do an ECG.
That's the ECG done. I've left it on the desk.
Coming around, you've got things like your crash trolley, guidelines, drugs. And then towards the back of the room, you'll see that you can actually leave the scenario. Now, there's actually 3 ways a scenario can end. You choose to leave, that time on that clock behind George runs out, or number 3, you give them a medication that they have reacted to. So we get asked quite a lot, can you call the patient? Absolutely. So I'm clicking on this thing. First thing you notice, blue hands, blue gloves come out in front of you. They are modelling your behaviour. This is not so much about the physical skill itself, but the decision to do these skills. Over on your phone, different departments, we could go ahead and phone our senior now. Now he's going to tell us to go away. Basically, he's going to ask us to go and assess that patient. So there's lots of logic in the background as well. So it knows if you haven't really gone to George and you haven't dug in and you're just asking them for help straight away, the system will recognise that.
Okay, I understand you're worried about this patient, but I think you've missed some steps here. Go back, take a focused history, examine the patient, and then think about some basic investigations to see if we can identify where this fever is coming from. He's going to need a fluid bolus, and I'd have a low threshold for giving antibiotics. Call me back if you need more help, or there are guidelines on the computer.
There you go. So if we do more with George and we go back, we will get a different response there. Notice that ECG. I will come back to that in a second. You've got your emergency bell there if you need it. Any medications you might need are in that cupboard. This is how it looks for the medical side. In your nursing scenarios, it's done alphabetically. Down on the computer, things like radiology, guidelines, medical records. So we can go in, we can order x-rays, and actually
we'll get that done now.
All the investigations come back in the scenario itself. So we will be able to pull that up later once it comes back. More guidelines to fall back on, so that you've got the sepsis ones there and other ones. So if you're not there, they do still have that scaffolding in place to fall back on. Medical history, what kind of medication they've been on. I'm actually going to do a few things practically just to show you how it all works. In terms of your trolley, you've got all your normal investigations. Anything that's not on top is underneath. So catheters, for example, swabs. You'll notice on the floor it says settings. So I've got writing.
Ready on the computer,
I've got writing that pops up. You can turn that off if you don't want it. You would just click on your settings and you can turn those captions off. I tend to just keep them on so everybody can hear everything. With George, two things you want to do. Number one, you want to talk to him, or number two, you want to assess him. If you want to talk to him, click on his head.
Can you tell me about what's brought you in today?
Well, I was fine yesterday, but started feeling unwell this morning. I've been hot and really shivery for a few hours. I've never felt this unwell before.
And aside from the issues you've mentioned, do you have any other medical problems?
So, my main problem is testicular cancer, which was diagnosed a few months ago. I've had radiotherapy and I'm on my last chemotherapy. I also have type 1 diabetes, but that's been really well controlled, even with all the treatment.
Okay, can you give me any more details about your treatment?
Sorry, doctor, I can never remember the details. My oncologist says things are going really well, though.
Have you had any previous surgeries or general anaesthetics?
Well, I had my testicle removed because of the cancer. Otherwise, no other surgeries.
Can you tell me what medications you're taking, please?
Well, my last cycle of chemo was a week ago. I can't remember what kind, but my partner's on away with a list of my tablets.
Are you allergic to anything?
Yeah, I'm very allergic to penicillin. I had it once and my throat swelled up and I couldn't breathe. I had to go to intensive care. It was terrifying.
That's done. All the relevant tests are ordered. I'll get them processed right away. That's the IV access in place.
Any weight loss or joint pain?
No.
So you'll see that we can do lots of different things all at once.
I'll make sure that's taken to the blood gas machine immediately.
You can delegate things to your nurse while you do something. You can still talk to George. Next thing you're going to want to do, assess George. So in terms of your examination menu, first thing to note, not in any particular A to E order, they decide where they want to start. I'm not going to stick to any order. I'm just going to show you a couple of things. But everything you would normally do, you can do in here. And hopefully you can hear these chest sounds. So you can hear the chest sounds, the heart sounds. You can look at the pupils. Just a second, I'll lie George down for an abdomen. Now you can do a bit of blended learning with this. If I was teaching and I was doing medical students,
Doctor, the ABG results are back. They're on the desk.
Thank you. I would pause that and say, right, get your stethoscopes out, show me how you auscultate the chest. So you can blend it alongside other things that you do as well. Let's do a quick abdo exam. And then now I'm going to show you in just a second how we get all of our investigations. So we're taking some bloods, ABGs, ECG, radiology. We've got different characters as well, so if anybody's thinking, is there anybody different to George? Absolutely. Different ages, different backgrounds.
Abdomen soft, non-tender, no masses.
Over by the computer, this is where all your investigations come back. So you can pull up your ECG and it pops up. And if you're in your headset, your VR headset, it literally jumps up in front of you. You've got your ABG results. So you can pause these scenarios. So you could say, if they're starting to kind of decipher these and what are they picking out, you could absolutely get them to do that. You've got your radiology. That's back now. And bloods as well. So once they've done everything they think they can do, and they've administered that medication, if we have a little look, does he want some fluids? Yeah, absolutely. So let's go ahead, pop some fluids up.
Those fluids are up and running. I'll let you know when that bag's finished.
You can then go back to that senior and you can hand over.
Okay, I've had a look at this patient's blood results on the computer and can see he's neutropenic. With a fever and high lactate, we should treat for neutropenic sepsis. Good work on giving fluids, but he's going to need urgent IV antibiotics. We also need to establish where this infection is coming from. There are guidelines on the computer if you need more help. I'll be down to review in 15 to 20 minutes.
Okay, so you can update George, you can update the nurse if you really wanted to. So I could just click on the nurse and update her on my clinical plan.
Let me update you on where we are clinically at the moment.
Okay, thanks for updating me on the situation and progress.
And then I can choose to flick to leave by the door, and hopefully it'll get a bit quieter. And it brings you in. Oh, I love that sound. Brings you into this stage. So how did that feel? So they can do that if they're in a group setting, they can do this self-guided reflection. If they're on their own, they'll typically probably jump through that section. And the next stage is their learning objectives. So they can come down, they can see if it's what they thought it was, splits it into their technical and the non-technical skills. Then as you come down further, it will timestamp everything. So you don't need to sit and scribe anymore. Everything's broken down, rationales behind every single one. And actually you'll see some even have guidelines. So we will stick to national guidelines. If you have more local policies or procedures that you want linked in there and changed out, we can absolutely do that. So if they clicked on that guideline, it will just jump them straight into whatever it is and they can read up on it. And then as you go down, all the things that went well and at what time versus all the things to think about the next time. So if you are going to meet your educational supervisor, or as an educational supervisor, you know, you've got a trainee coming, they can pull this up for you. And you can look and talk through it. So yeah, you've got all of that. And then at the bottom, it has a score, it has a time. So if they have got those simulated hours, for instance, this counts towards it. If you're interested, how do they calculate the score? All done on clinical importance. And then the idea is that they'd come in, and if they want to, they can reflect with whatever they like. They can save that. They don't have to do a reflection every time. They can come back and do a reflection whenever they want, but it will save it to their account. Bringing you back up to the top, the very first tab was to launch a scenario. The second tab is session history. So this is a little bit like an e-learning passport. So if they do come up for e-portfolios and they need evidence, this is where they want to come. They can pull up whatever it is they've been into. It's saved it all. Click on it, pulls them back into that feedback page, and they can reflect later if they needed to. What you can also do, so if you are thinking more e-portfolios, right click and come down to print. At that point, this box pops up, save it as a PDF. That will save this feedback to your computer. So then you can just export it up to whatever it is you use. We'll tell them everything down to that score, time, and your reflection if you've done one. Then on a personal level, your analytics. So you'll get to see your average score. Hopefully your progress looks nothing like mine. I'm in and out all the time, but I quite like the skills performance. So it will tell you your areas of weakness versus areas of strength. Yeah, so you've got some nice analytics there. Now, for those of you that are a trainee that want to kind of go into this platform, if you're an FY1, obviously you're going to have your individual account. There is a two-step process to this. So number one, you want to sign on and set up that password as it comes through. And number two, you want to download the software. To get that software, it's all under this Getting Started tab. So I would, watching that, these videos are super short. Watch that 2-minute video, which will introduce you. Scroll down. If you're on a Windows, click your Windows link versus if you're on a Mac, click your Mac link. Now, it may be that the team want to get this onto computers in the hospital, but remember, they typically tend to be locked down for security purposes. That can be a lot more long-winded. So this is for you to go away with and access from the comfort of your own home on your devices. So that is from the trainee perspective, really. And if there's any faculty out there, anybody teaching or educational supervisors that think, I'd love to actually play through some of those scenarios, absolutely, we can give you access. If you get in contact with your medical education team, we can sort that out. Now, I have one more thing I want to show you. I'd mentioned all the rich data analytics in the background. So if you're thinking of this from the other side and you want to see not necessarily the scenario in action, but everything else in the background, we would give you another side of the platform. So it kind of comes in two views, if you like. This is much more from a faculty perspective. And the bit I want to kind of focus on is analytics. Now, the analytics they see from their side are just their personal analytics, and the analytics you see from your side are much more in depth. So thinking of this, it could be looking at this on a hospital level, and then we create subgroups. So you could have maybe FY1s, FY2s, advanced nurses, or it could be regionally. So for example, your FY1s are actually under HEE Northwest. I think that's right, isn't it? Yeah, so they are sitting under this regionally. So all would be all regions, all hospitals together, and the group would be, you know, FY1, FY2, so that at a regional level, HEE can get down and see exactly how their F1s and their F2s are doing. And you can get it right down to that trainee level or clinician level. I have got it to all at the moment. So if I scan down, this is you looking at it on a massive scale. So you can see across your hospital, you know, how many are engaging, how many jump back straight back in. So, you know, they're digesting that feedback and going, right, okay, let me try and improve next time round. All the way down to how many hours of simulation are you achieving? How many sessions are you running? And when you give them that access at home, you'll be surprised at how many hours of simulation you can suddenly achieve. Skills performance, that's a nice one when looking at it on that bird's eye view, on that top down approach, because then it's telling you where your areas of weakness are, and you can plug those gaps with other activities. And you can see, you know, exactly when you're utilising OMS the most. The next step that people ask is, well, that's great, but now I want to go one step further and I want to see exactly what they're doing. Of course, you can refine it by scenario. So if you're a tutor and you're saying, I want you to do this scenario by next week, you could pull up your group, look at that scenario for that week. Sessions view is your other option. So if I filter this to me, as if I'm one of your clinicians, all of a sudden it's pulling through everything I'm doing. So you can see exactly what I've done, what scenarios I've chosen, what scores I've achieved, how long I lasted. And if you come across to this session feedback link, this is how you jump into all of their feedback. So you no longer need that trainee or at your fingertips. Everything is here for you. So you can go home as a faculty and you can see exactly what they're jumping into at what times. Now, I appreciate that that's a lot of information very fast. I would pause, but I don't think we've got any attendees right now, but I will leave my email address in case anybody does come through and does decide that they want to find out more. Quickly, before I wrap this up, I just want to touch on a couple of things. So hardware specifications. These are your minimum hardware specifications. Implementation. So how do you use this? Typically you use it one of four ways. So they either go off and they do it on their own, which is great and faculty free, brilliant. Peer reviewing, again, faculty free option. So what we have is some trainees that love to jump on Teams or Zoom in their own time. One jumps in on their account, shares their screen, goes through a scenario, the other one reviews, and then they swap round, and then the other one jumps on their account. Faculty-led webinars. Like I said, if you had a VR kit or some VR within your institution, you could put somebody in a headset, share that on a big screen and have more than one person actually watching in the background. That works in person, but you can do this on screen as well. So there's no harm in you as a faculty or I don't know, maybe you've got trust grades that want to get involved in teaching or whoever it may be. And, you know, they set up a time, they jump into a scenario, they sign on and everybody starts helping. So here's George, what do you want me to do? And then, you know, medical students go, oh, let's put some obs on. You know, I want to see what their breathing's like. So they start to get involved even though they're at a distance and you can still debrief. So they are the main ways, but we can work with you to find more. Everybody's got different existing resources, so I'm very happy to kind of come by, see what resources you've got and give you a helping hand. And then some just tips and tricks really for success. Can help to have a champion. We actually do have Oxford University, and what they've decided to do is have super users. So they've got a select few trusted students that are quite advanced, and they take groups of trainees through. So they are using them rather than faculty to get them through these scenarios. We can provide, so if you are a faculty out there thinking this is great, but where do I start? We can help train you. So we will give you all the training, we will get your account set up. Again, first point of call, go back to medical education department, and we will sort it from there. And then just using the tools on the platform, your getting started page, there's short videos that are normally really good, and we'll walk you through all sorts of things. Another thing just to note, if anybody's ever stuck, by the way, it doesn't matter whether you're a trainee, whether you are a faculty member, an admin team, there is a support bubble. So when you sign on to www.oms-at.com, the first thing in the bottom right hand corner is a blue bubble. So at any time you can reach out to us. Now, all you'd click is send us a message. We are there 9 AM till 9 PM Monday to Friday. So if something's not working or you're just thinking, I've completely forgot what to do, come through and we'll give you a helping hand. That's one way. The other way is just by emailing support@oxfordmedicalsimulation.com, and they will do the same. And I'm going to leave it there, I think. So what I'm going to do, if anybody wants to ask me any questions, do feel free to email me directly. So that is just Laura, Laura, @oxfordmedicalsimulation.com. I hope that was useful. If I've missed anything out, give me a shout and I'll get back in touch. Thank you.
Thank you, Laura. We'll end now.
Perfect. And let me just drop